Right now, let's go to Dale Bellis. Dale is the founder and the executive director of Liberty HealthShare. We have been involved, the Fräulein and I, with Liberty HealthShare now going on 4 years or maybe 3, whenever Obamacare started, and our premiums went from $500 a month to $1,000, and our deductible under Obamacare went from $500 per person, $1,500 for the family, up to $10,000. So basically, we paid Obama $1,000 and had catastrophic insurance. That's what we had until we found Liberty HealthShare, which has been a godsend to us, which is a share system where our share per month is down to $550, and the unshared amount is $500 per person, but it's like paying cash. It's great. And I just couldn't be happier with it. Anybody out there, if you're getting hosed by Obamacare, if you own a small business, if you're a contractor, if you're on a 1099, if you can't afford Obamacare insurance, or you don't have the government plan or a big plan subsidized through your company, and you're out there holding the ball with trying to get insurance, you really should check out Liberty HealthShare, because I've been so happy with it. It's going to save you money. It's a great concept. Why more people aren't in it are beyond me, because it's great, and I just couldn't be happier with it. And all you have to do is go to libertyhealthshare.org. Joining us now, it's founder and executive director Dale Bellis. Dale, good to have you.
John, it is such a pleasure to be with you. Thank you so much for the opportunity. Number one, I've just got to say, go Tribe.
Oh, my goodness. That's right. You're in.
And then number two, you're absolutely right. The healthcare system in America is frozen in place because of the indecision of Congress to lead on this matter. And they're asking, frankly, all the wrong questions, John, and they're looking for solutions in all the wrong places. And that's why Liberty HealthShare, as a national grassroots movement of people of faith and values who join together to pay each other's medical bills, we've dropped out of the system. And we've just said we're not going to rely on the ordinary process for meeting health care costs, which is through insurance. In fact, we represent freedom from health insurance. Mm-hmm. We set the rules ourselves. We determine what bills we will share in, and we do it on the basis of a set of values that put the individual consumer in place, where we're taking control and responsibility over the care of our health.
That's really what makes a difference. And look, I know I'm one of your biggest fans because I've been a customer and I've seen what it's done for our family since we became part of the Liberty HealthShare family. But the thing is, it just got us out of the whole insurance rat race, Dale. We're just out.
You were out.
And we're out, and we're free, and I don't have to deal with any of this.
Right.
And this is the thing I love about it. And, you know, some people get intimidated because they say, well, does anybody take it? Everybody takes it. People are so conditioned to, well, is it in my network? If it's a doctor, they take it. If it's a hospital, they take it. And if they don't recognize it, and I've gone to different things where they're like, what is this? I'm like, okay, there's an 800 number here. Call the number. While I'm in with a doctor, call this number, right? Just call it up. Right. Here it is, 855-585-4237. Call the number. Somebody will answer it, and just ask them whatever questions you have to ask in order to get this done. And that's what they do. They pick up the phone. They get their answers. They come back in. I'm in the doctor's office, and they say, all right, it's done. It's all, you know, we have it figured out. 5 minutes. And it's like paying cash. That's why this thing, why everybody's not in it, I don't know. I just don't.
Well, it's because of the mindset that believes that the only way to meet healthcare costs is through insurance. And that's why we've just grown up as a grassroots movement from the bottom up, whereas D.C. and Washington elites have been attempting to create a top-down solution. And frankly, John, that approach is what misses the point. They're not talking about how do we improve medical care. How do we lower costs in terms of the actual care that we receive? How do we improve access? They're not talking about that. They're talking about providing health insurance in a way that gives access and affordability. That is the result of the cost of medical care that has just gone like a skyrocket. We address that just as you've described. We're self-pay patients. We make our own choices and decisions about our care, and it's our money at stake out of our own pocket and the pockets of our fellow members, and that simply changes the mentality completely when you're consuming health care at the doctor's office or at the hospital.
It changes your mindset, and one of the things you have to do in order to get involved with Liberty HealthShare and this different plan is you have to get out of the insurance mentality, of the provider of insurance mentality and all the rigmarole and nonsense that you go through, and you got to change your mindset from that and from, who's in my network, who's not in my network, what hospital covers it. All that goes away. Remember, Obama said, if you like your doctor, you can keep your doctor. Lie. With Liberty, doesn't matter who your doctor is, doesn't matter what your hospital is. Nothing matters, right? Because it's the same thing as if you were paying cash, right? It's the exact same thing. But you're not, because you're part of the share system. The other thing I love about this is when we pay our share fee every month, we get to see exactly who that is going to, if we choose to. So we can say we paid our $550 and it went to Joe Smith, who had a colonoscopy in Cincinnati, all right? I mean, that's why I just can't believe that anybody that doesn't have Cadillac coverage, or they're with the government, or their company is subsidizing it, why they wouldn't see this as an option. Especially if you own a small business, you're a contractor, you work on a 1099, you have to provide your own insurance for your family. This is such a great, freeing alternative, Dale.
Oh, in fact, that is among the top 3 reasons our members feed back to us as to their satisfaction, because it gives them a sense of purpose and fulfillment, knowing that their money is going to an actual live person who has medical bills. They're sending their money under our system based upon our members setting aside every month their share amount in their share box. Our technology then assigns that to another person, and you see your money flow to the individual who has the expense, and you message them with cheer, encouragement, or prayer at the same time. Our members say that's what gives such significance, because their money's not going to a company black hole somewhere. They literally see it transparently online transact every month going to another person, and that is significant.
All right, Dale Bellis with us. Dale Bellis is the executive director and the founder of Liberty HealthShare. Now, to get involved or you want more information, it's real easy to do. Give them a call today, 855-585-4237, 855-585-4237, or just go to libertyhealthshare.org. One of the things you can do right now is right online, go to libertyhealthshare.org, and what you can do is, get this, you can just ask them for a quotation. You can just fill everything out and say, hey, just tell me what my share amount will be. Ask for a quotation. It's going to come back. It's going to knock your socks off. I guarantee, as they say in Louisiana. Dale, I've got a couple of questions here from listeners. Steve in Chesapeake says, John, could you please ask Dale if Liberty HealthShare is considering covering mental health issues?
That is, mental health is an area that we have to date left to the individual choice of our members and meeting those costs. That's dental, eye care, hearing, and we've approached the arena of health costs with this philosophy, John, that says we're here to assist with those things that are unexpected and unaffordable. If you can plan for it, budget for it, anticipate it, do so, because those are typically lower cost expenses. And so our members simply take responsibility for that. We have had some of the requests from members to increase eligibility for sharing into talk therapy and mental health areas, and we'll be putting that out for a feedback and vote to our members this coming vote, which will be in January. We do that every year, and our members will decide that question. And so the answer is yes, we're considering it, but it will be at the decision of our total membership as to whether that's an area that they would feel that this is a burdensome matter that we need to help share and lift the burden with our fellow members, and we'll conclude that in January. So thanks for that question. That's a good one.
Oh, well, it sounds like you're working on it, Dale. I got one other one here that I want to ask as you go forward in this. Look, they couldn't repeal Obamacare, the Republicans. They lied to their constituents for the past 84 months, raised money off it. Obamacare is here to stay. Now, let me say what this means. Everybody's projecting there's going to be another major premium increase in January. In Virginia especially, we're going to get a 15 to a 20% increase in premiums in January. In Arizona, it's going to be 50%, all right? So premiums are going to continue to go up. If somebody is overpaying now, I mean, is now this not the time to check your organization out or what?
It really is, because we're not subject under the ACA to the open enrollment periods. It is a month-to-month participation, and folks can engage in their own personal health care reform and drop out of the health insurance system and adopt the Liberty HealthShare sharing mentality of mutual aid, mutual assistance based upon our shared values. You can do that at any time.
All right. That is great information. Again, I know I'm a walking, talking testimonial for Liberty HealthShare, but we have been so happy with it. And I tell you what, if you're in the position that we were in, where you just can't pay these outrageous amounts of money for basic care for your family, and you got to get the coverage, because if you don't, you're still paying the fine, right? That's still the law, and so you don't want to do that. So Liberty HealthShare, check it out. Go to libertyhealthshare.org. Just ask them for a quotation. That's it. And like when I got mine back, Dale, I thought it was a typo. I'm like, okay, I must have said I'm just covering me. I must have not put my children in. It's going to blow you away, or you can give them a call, 855-585-4237, or go to libertyhealthshare.org. And by the way, Dale, we're expanding to AM 570. We become part of the Salem Network in a couple of weeks, so we're excited about that. And so we continue to evangelize your message, right, through Washington, D.C. and Northern Virginia. So I know
we're excited about that. Congratulations, John.
All right. Now, before you hang up, Dale, I'm a lifelong Astro fan. And I like you, I really do, but I'm a baseball hater. And let me tell you what that means. I hate every team that's not mine. Every player, every manager, every stadium, every hot dog they sell. I hate their minor league system. I hate the secretaries, and I think their women are ugly. So as far as your Cleveland tribe is concerned, first of all, you got to get by New York, not so easy. And then you got to get by us. And I hate Cleveland. I hate the Indians. I hate the tribe. I hate your logo. And I think we're going to kick your butt.
Well, we'll find out, but we'll have to talk about that offline, my friend. Those are some fighting words right there.
When I'm sitting there watching my Astros play in the World Series and the Indians are playing golf, give me a call.
Then you can rub it in. That's good.
All right, Dale. Thank you very much. Dale Bellis, Liberty HealthShare, an Indians fan. Yeah, we're not going to hold that against them. Oh, yeah, we are. 855-585-4237. 855-585-4237. Or go to libertyhealthshare.org. That's libertyhealthshare.org.